Hi everybody, this is Dr. Ravindran Kumeran. I am a surgical gastroenterologist practicing in Apollo Firstmed Hospitals, Pundumalai Road, Kilpauk. Today we are going to talk about a very common problem in the community referred to as piles. Now the medical proper terminology for this is hemorrhoids. Piles is a very prevalent problem in the community, and there is a lot of emotional constraints related to this. Patients are very hesitant about coming to the surgeon to have themselves checked, but actually it's a very simple, straightforward problem. I'll try and explain as to what it is. So the act of defecation, passing motion, the bowel movement every day is a very normal phenomenon. All of us have to go through it. We have to refer to other mammals to see how they behave. All mammals defecate, and they on an average take maybe 2-3 seconds to do that. We are the only mammal who spend minutes, sometimes even hours in the toilet trying to defecate. And that is the sole reason as to why somebody develops piles. Piles is virtually non-existent in any other mammal as a disease. So piles happens because of pressure in the anus causing the blood vessels inside the anus to burst and cause bleeding. Typically it gives rise to bleeding without any pain. So a patient will say, I am seeing bright red blood in the toilet, in the commode, and there is no pain, doctor. This is the typical history you get from a patient. You have to have yourself examined ideally by a surgeon, because it is very important for somebody to put their finger up your bottom to be able to confirm that this is what the diagnosis is, because there can sometimes be other diseases causing similar presentation whereby they bleed from the bottom. How do you go about this? See, there is something called as internal piles and external piles. Internal piles is the one which causes bleeding. External piles is the flesh which comes on the outer surface of the anus, and that can sometimes be very painful also. You can have small blood vessels burst within the skin of the outside of the anus and cause huge swellings which can be very painful. The root cause is pushing, sitting and straining in the toilet. That has to be eliminated first. That is the first treatment. You cannot sit in the toilet for anything more than 30 seconds. If you are able to achieve that, more than 50% of the patients with bleeding will never have a problem again in their life. You have to eat food which is rich in fiber, which gives rise to big, bulky, soft stools. So if your motions are nice and soft, then again the problem is solved. Now there are a small group of patients who have had this problem for years and who come very late. Now those kind of patients unfortunately have to have some kind of surgical remedy done to them to get over the problem. That can be done through surgeries which do not cause any scar on the outside of the anus. So you can have an almost painless surgery done to get rid of this problem. But most patients do not require surgical intervention, however need to have a surgical consult to make sure we are not missing some other pathology. Bleeding from the bottom, bright red blood, 90% it is only piles, but has to be confirmed by a surgeon. Please remember that in future, and do not spend any unnecessary time in the toilet. Toilet time has to be as brief as possible, preferably in seconds and not in minutes. Thank you.